This is grade 2 aspirants. I am Dr. Suchitra, and in this session I am going to discuss the grant test paper 1 discussion. So coming to the grant test paper, so coming to the first question. So here first question is, digoxin is a medication used to treat heart failure and certain arrhythmias. So what is the primary mechanism of action of this digoxin? Yes. So what is this heart failure first of all? So heart failure is nothing but the heart is unable to pump the blood. Okay, it is unable to pump the blood. So here they have given the 4 options. So first option is inhibition of sodium potassium ATPase. Okay, sodium potassium ATPase enzyme. And the second one is blockade of beta adrenergic receptors. And third option is inhibition of angiotensin converting enzyme. And next one is inhibition of calcium channels. Right. So coming to the first option, so what is it is going to treat the heart failure, right? So nothing but heart is not able to pump the blood. So what is this sodium potassium ATPase pump? So this is considered as a myocardial membrane. So the sodium potassium pump, so here we will be having, this is a protein, sodium potassium ATP is a protein which is present in the cell membrane and which is mainly responsible for the nerve impulse transmission or for maintaining the membrane potential. So here for every 1 ATP generally 3 sodium ions will be excluded out, and for 2 sodium will be entering into the intracell. 2 potassium ions will be entering into this one. Right. So here what happens? So here the ATPase enzyme is responsible for this influx and outgoing of the sodium ions and potassium ions. So here if you are blocking this one, see inhibition of sodium potassium ATPase pump. So what this digoxin will do? This digoxin, it inhibits our sodium potassium ATPase enzyme. Okay, so whenever it is stopping that one, then what is happening here? The sodium ion concentration is increasing. Sodium ion concentration is increasing. So along with that, the calcium ions also increases. So due to increase in calcium ions, calcium is mainly responsible for contraction of that muscle. Okay, so due to increase in the calcium ions, what is happening here? It is contracting the muscle. So more amount of means it is forcing the heart to pump the blood. Okay, so thereby it increases the cardiac output. So cardiac output is increasing. So thus it acts by, so this is the main mechanism by which our digoxin will be used in treating the heart failure. So the first answer A is the correct option for this one. So what are the other options like blockade of beta adrenergic receptors and inhibition of angiotensin converting enzyme and inhibition of calcium channels. So they are mainly responsible for vasodilation and helps in treating the hypertension. Let us go to the next question. Coming to the next question. So the drug allopurinol is commonly used in treatment of gout. Yes, it is used for treatment of gout. So what is the primary mode of action of allopurinol? So allopurinol is the drug which is used for treating the gout. So first of all, what is this gout? So gout is a condition where the uric acid crystals gets accumulated or it gets deposited in the joints. Okay, right. What are the different options here they have given? Option A is inhibition of xanthine oxidase enzyme. And next one is inhibition of cyclooxygenase enzyme. And third is activation of GABA receptors. And fourth one is inhibition of histamine release. Okay, so gout is a condition where it gets deposited, that is uric acid gets deposited in the joints. Right. So let us see what is this uric acid. Uric acid is the waste metabolite, or it is the waste product that has to be eliminated out of the body through urine. Okay, so here what is happening? See this means whatever the purines, okay, purines which are obtained by the degradation of these nucleotides. So these purines, they undergoes catabolism. they undergo catabolism to hypoxanthine. They undergo catabolism to hypoxanthine in the presence of xanthine oxidase enzyme. Xanthine oxidase enzyme. Okay, right. And this hypoxanthine, it gets catabolizes to xanthine. So, this also takes place in the presence of the same enzyme, that is xanthine oxidase, and which finally catabolizes to uric acid. And this uric acid should get excreted out of the body. Okay, this is the waste material and it should be excreted through urine. But sometimes what happens, this gets deposited in the joints. So, due to the deposition in the joints, it leads to deposited in joints and which leads to gout. Okay, now xanthine oxidase is mainly responsible for formation of this uric acid. So, what will be the remedy for this? So, here we have to inhibit this xanthine oxidase. This xanthine oxidase enzyme should be inhibited so that it will not be getting converted into uric acid, so that it will not get deposited in the joints. Okay, so this is the second question and correct answer is inhibition of xanthine oxidase. Let us move to the third question. So, here third question is, right, coming to the third question, levothyroxine is a synthetic form of which hormones? Okay, commonly used to treat hypothyroidism. Yes, levothyroxine is used for treating hypothyroidism. So, what is this hypothyroidism? Hypothyroidism is a condition where the T3 and T4 hormones are less production of T3 and T4 will be taking place. Okay, so T3 is nothing but our triiodothyronine. So, these are the two hormones which are produced by the thyroid gland, and T4 is thyroxine. Okay, these are mainly responsible for energy metabolism and growth of a person. Right. So, these hormones, so in hypothyroidism what is happening? There is a decrease in levels of this thyroid hormones, that is thyroxine. So, what we are doing? We are giving a synthetic form of this hormone. So, the name itself tells that it is having a thyroxine, isn't it? So, here they have given 4 options. So, one is insulin, cortisol, thyroxine and triiodothyronine. So, the correct option will be thyroxine. So, which is which we are going to, it's a synthetic form of our thyroxine. Right. And one more thing I want to tell you here, levothyroxine. So, generally this thyroxine will exist in 2 forms. One is levo form and other one is dextro form. Okay. So, this levo form, it is used for treating hypothyroidism, whereas the dextro form is used for treating hyperlipidemia or hypercholesteremia. Okay, you remember this one. So, levothyroxine, generally it is a synthetic form of thyroxine and it exists in 2 forms. One is levo and other one is dextro. And levo is useful for treating the hypothyroidism, whereas dextro is used for treating this hyperlipidemia. Right, coming to the next question. So, ophthalmic preparations comes under schedule. So, there are many schedules like A to Z. Okay. So, here what they have given options, schedule Y, schedule N, schedule S and schedule F. Okay, done. Schedule Y. So, generally schedule Y, it consists of standards and regulations or guidelines for clinical trials. It consists of guidelines for clinical trials for a new drug, clinical trials. Okay, right. Just you remember here, Y, schedule Y. So, how and why the drug is entering into the market? Why the drug will not enter into the market? If it fails the clinical trials, definitely it is not going to enter into the market. So, like that you can remember that one. Y is for clinical trials. Okay. Second one is schedule N. N for new. New is nothing but for regulations and requirements for opening a new pharmacy. Therefore, you remember N for new. So, for opening, this contains all regulations and requirements for opening a new pharmacy. Okay, next coming to the third C. C is schedule S. S for smartness. So, you can remember S for smartness. Smartness is nothing but we'll be using cosmetics, isn't it? So, standards and regulations, it includes the standards and regulations for cosmetics. Cosmetics and toiletries. Right. So, last one is schedule F. Okay. So, here you make it corrected as schedule FF. Okay. Schedule FF contains the standards and regulations for our ophthalmic preparations. It contains standards and regulations and standards for ophthalmic preparations. Okay, right. So, under schedule FF, okay, here they have given F, right. So, F contains or F includes the standards and regulations for blood bank. It is for blood bank, and F also consists of F1, F2, F3, F1, F2 and F3 schedules, and F1 it consists of or it includes the standards for vaccines, and F2 it includes the standards for surgical dressings, and F3 it includes the standards for umbilical tapes. Okay, then what will be the correct answer? Now the correct answer will be schedule FF. Okay, right. So you correct that option also. So coming to the next question, right. So determine the correctness of the following. So here they have given assertion and reason. Okay. So under assertion, what they have given? Tannins are polyphenolic substances. Okay, occurring in plants. Yes, tannins are nothing but these are phenol compounds which occurs in the plants. Next, hydrolyzable and condensable tannins are identified by matchstick test. That is also correct. Okay, because these tannins are of two types. One is hydrolyzable tannins as well as condensed tannins, and these tannins can be identified by matchstick test, and this matchstick test is also known as Katechin test. So, other tests for determining this tannins are like a gold beta skin test and gelatin test and ferric chloride test, and by using ferric chloride test we can even identify or we can differentiate both these hydrolyzable as well as condensed tannins. And what is the reason? So, the condensed tannins are resistant to acid hydrolysis. Yes, that is also true. Condensed tannins are resistant, whereas hydrolyzable tannins are not resistant. Okay, and therefore, they stain the lignin present in the matchstick. So, the reason is correct and assertion is correct, but reason is not the exact form of this, exact answer for this reason for this assertion. Okay, so what are the options here? Both A and R are true, and R is correct reason for A. Okay, next one, both A and R are true and R is not correct reason for A. Next, A is true but R is not correct reason for A. And last one is both A and R are false. Assertion and reason are false. So, what will be the correct answer? Both A and R are true and R is not the correct reason for A. Right? So, next question number 6. Yes. So, Central Drug Laboratory established under the control of central government in. So, where it is established? It is established in Kolkata. So, this is a direct question only. It is established in Kolkata. Coming to the next question, question number 6, 7th. Right. So here, which of the following hormonal dosage is given as an oral administration to prevent pregnancy? Okay. So what are the 4 options here? Relaxin, progesterone, estradiol and epinephrine. So what is relaxin? So relaxin is a hormone which is released by which is produced by ovaries, and it is mainly responsible, or it is mainly helps during labor or during delivery. Okay, which helps in relaxing the ligaments and muscles of pelvis. Okay, next second one is progesterone. So progesterone hormone, it mainly helps in maintaining the menstrual cycle or plays an important role in menstruation. Okay, right. Next third one, estradiol. Estradiol is a hormone which is mainly used to relieve the symptoms after menopause stage. So during the menopause stage, whatever the symptoms will be there, so it is used to reduce the symptoms of menopause stage. Right. Next, last epinephrine, nothing but our adrenaline, which is a flight and fight hormone. Okay, right. So what will be the correct answer here? So progesterone, which brings about menstruation. So we can use it as an oral administration to prevent the pregnancy. So correct option is B, progesterone. So next question, that is question 8. Drugs and Cosmetics Act 1940 was last amended in year. So it is also a direct question, that is in 2008. Next question, question 9, right. So here iron is transported by. Okay, so what are the 4 options? Here they have given transferrin, mitochondria, hemosiderin and metalloenzymes. So the first one is transferrin. So what is this transferrin? Transferrin is a protein which attaches to iron and transport the iron throughout the body. Okay, it is a protein which attaches to iron and thereby helps in transporting the iron throughout the body. So obviously the first one is the correct option. So next question, that is question 10. Who was the first chairman of Drug Enquiry Committee? So here they have given 4 options. So one is Mukherjee, B. Mukherjee, R.N. Chopra, Joseph Boré and R.D. Dalal. So the correct answer is B, that is R.N. Chopra. So it is also a direct question. So next is 11th question. So here diacetylmorphine is also known as. So they have given 4 options: Ganza, heroin, charas and cocaine. So the correct answer is heroin. So it's also a direct question. Next, question 12. Right. So minimum training right. So the minimum training required to be a pharmacist. So here they have given 4 options: 100 hours, 500 hours, 300 hours and 800 hours. So 800 minimum practical minimum practical training should be 500 hours. So this is the correct answer. So next one is right. Which among the following tablets is used in oral cavity? So which gets dispersed in the oral cavity itself. So what are those? So what are the options? Hypodermic tablets, troches, film coated tablets and dispersing tablets. It is dispersing tablet. Okay, done. So hypodermic tablets. So the name itself tells that hypodermic. Okay, below the derma, that is skin. It is related to a skin. Okay, so these are hypodermic tablets. So generally this will be solubilized tablet form that will be dissolved in our water for injection and then it will be injected. So these are hypodermic tablets. These are not meant for our oral cavity, right? So next is troches. So what are these troches? Troches are nothing but they are medicated lozenges. Okay, so they gets solubilized in the mouth itself. So what is the correct answer? So which among the following tablet is used in oral cavity? So troches are used in oral cavity. Next, film coated tablets. So film coated tablets are taken oral route, but they get absorbed either in the stomach or intestine depending upon the coating whatever we have given. Okay, right. Last one is dispersible tablets. So dispersible tablets, they gets immediately when you put that into the water, it gets dispersed there only. Okay, so the correct option will be troches. Coming to the next question. So what is the other term for MTP? So MTP means medical termination of pregnancy. Medical termination of pregnancy. So what are the four options they have given here? Induced abortion, forced death, pregnancy induced sterilization, unwanted pregnancy. So what is the main MTP stands for? Medical termination of pregnancy. Means here we are terminating the pregnancy, means inducing abortion. So the correct answer will be induced abortion. So next question is 15th question. Right. What period of pregnancy are the MTP safest? Okay, at what period these are safest? So here they have given four options: first trimester, second trimester, third trimester and fourth trimester. Okay, generally these are safest during first 3 months only. So that is first trimester is the correct answer. Right, come to the next question. 16. Clinical trial protocol for a new molecule is covered under. So just now we have discussed the same means options also. So what is the first option here? Schedule P, Schedule R, Schedule Y and Schedule T. Okay, we have already discussed that is Schedule Y. Why the drug will not enter into the market. Okay, that you blindly you remember that one. So why means because the clinical trials are not passed. Okay, so it is related to the schedules. It is related, it includes all the guidelines for clinical trials. Okay, right, Schedule Y. Right, correct option is the Schedule Y. Next, what is the Schedule P? Schedule P is for storage and shelf life, and not only that one, and under P again there will be P1. So P1 it is related to packaging. P1 is related to packaging. Okay, right. P is related to shelf life and storage. And what is R? R includes the regulations and standards for condoms. And next one, T, Schedule T. It includes the standards for good manufacturing practices of Ayurvedic, Siddha and Unani. Okay, so what is the correct answer? Schedule Y is the correct answer for this one. Right. So coming to the next question, question 17. So the normal urine primarily consists of, so there will be normal urine and abnormal urine. Okay, so normal urine primarily consists of, what it consists of? So here water, first option is water, protein and sodium. Okay, so water and sodium are common, but here what is there included? Protein. So proteins will not be excreted in the urine. Okay, so if the proteins are excreted in the urine, it is considered as an abnormal condition, that is proteinuria. Right, so this is not the correct answer. And what is the second one? Water, urea and protein. Again here also they have given protein. So this is also not correct answer. And third option is water, urea and sodium chloride. Yes, water is a waste material, water will be eliminated, urea is a waste product, and next sodium chloride. This will be the correct option. And the fourth one is water, urea and bilirubin. Yes, here bilirubin is a pigment. Right. So, generally this bilirubin is produced by degradation of or breakdown of this RBC. So, whenever the RBC gets degraded or it break down, then it is going to produce bilirubin, and this bilirubin will be eliminated from our body by the liver. Okay. If the liver is not working properly, then what happens at that time? This bilirubin will be excreted in the urine. If you see the bilirubin content in the urine, it indicates that the liver functioning is abnormal. Okay. So, here option 3 is the correct one. Coming to the next question, 18th question. Okay. So, here a 17-year-old girl decided to go on starvation diet, right? So, after 1 week of starving herself, what substance would most likely to be found in her urine? Okay, right. So, whenever any person undergoes starvation, okay, so what happens at that time? Our body, each and every cell requires glucose. Okay, so in that condition, the glycogen, whatever it is stored, that will be getting converted into glucose. If that is also completed, then it goes to fat, means it start burning our fat. So, during burning of this fat, it is going to produce ketones. Okay, if it is not, if you are not caring that one, or if the ketone bodies, more ketone bodies are formed in the blood, then what happens? It leads to ketoacidosis, okay, which is a very lethal to a person. It also leads to the death of a person. So, what will see in the urine? Here they have given 4 options: protein, ketones, glucose and blood. So, the correct answer is ketones. Coming to the next question, 19th question, right. The vitamin B is vital for, okay. So, what are the main roles of this vitamin B? Here they have given option A, energy metabolism, option B, the transfer of amino group from one amino acid to another, yes, the synthesis of neurotransmitters. Since this vitamin B acts as a cofactor for many enzymes, so it will perform all these functions. Okay, so therefore option A, option B, option C are correct. So all the above, all of the above. Coming to the next question, question 20. So what is the main role of vitamin C? Right, here they have given colloidal production. No, not yet, not that one. Next, energy metabolism, collagen production, preventing the common cold. Okay, so what is the important roles of this vitamin C? So the main important roles of this vitamin C is that it acts as an antioxidant, it helps in tissue repair and growth, and it also helps in collagen production. Okay, so here out of this, this is the best option, and it also plays an important role in iron absorption also. Okay, so here out of these 3, collagen production is the correct answer. Next question is 21, right, which is known as spirit of salt. Yes, so here they have given 4 options, that is hydrochloric acid, sodium hydroxide, alum and zinc sulfate. Yes, here hydrochloric acid. So hydrochloric acid, it is a direct synonym of this hydrochloric acid. So the synonyms of hydrochloric acids are spirit of salt, and it is also known as muriatic acid. And it is also known as acidum hydrochloricum. Okay, so both are this spirit of salt and muriatic acid and acidum hydrochloricum are the 3 synonyms of this hydrochloric acid. So the first option is the correct answer. Next question, which of the following is a tricarboxylic acid? Okay. So tricarboxylic acid. Right, here what is the first option? Acetic acid, right. So what is the acetic acid? CH3COOH. So it is a monoacetic acid. This is a monoacetic acid. So, it is having only COOH, one COOH group. So, it is a monoacetic acid. Second option is succinic acid. Succinic acid, it is structure is COOH, CH2, CH2 and COOH. So, it is a dicarboxylic acid. So, COOH, COOH, two COOHs are there. So, it is a dicarboxylic acid. And next coming to the oxaloacetic acid. So, oxaloacetic acid, COOH, CO, CH2 and COOH. Okay, so this is oxaloacetic acid. Okay, so oxa is nothing but ketone. So one of this CH2 will be replaced, hydrogen will be replaced, hydrogens are replaced by this oxygen. So this is also a dicarboxylic acid. And what is the next one? Citric acid. So citric acid, so its structure is COOH, CH2, next COH, COOH, CH2 and COOH. So, it is having 3 carboxylic acid groups. Therefore, citric acid is a correct answer for this one. So, it is a tricarboxylic acid. Next question is question 23. Which of the following lipids act as lung surfactants? Okay. So, here what they have given? Phosphatidylcholine, phosphatidylethanolamine, ceramide and phosphatidyl'inositol. So, out of this, the first one is the correct answer, that is phosphatidylcholine. So, what is the use of this lung surfactants? So, generally the alveoli, whatever it is present, these surfactants, they will be coating this alveoli. So, after coating, they prevent the collapsing of this alveoli during exhalation. See, we will be inhaling and exhaling, right? So, whenever we are inhaling, it gets bulges, and whenever we are exhaling, again it starts collapsing. So, in order to prevent the sticking and collapsing of this alveoli, generally lung surfactants will be coating over that alveoli. So, that is phosphatidylcholine is one of the lipid which acts as a lung surfactant. Coming to the next question. Question 24. Hypercholesteremia. Okay, hypercholesteremia refers to a condition with high cholesterol with a serum cholesterol level of, it's a generally it's a range of this hypercholesteremia, right? So here they have given 4 options, that is greater than, more than 160 milligram per deciliter and greater than 200 mg per deciliter and greater than 250 mg per deciliter and greater than 280 mg per deciliter. So, the correct answer is this one. So, 240, greater than 240 is considered as the hypercholesteremia. So, if the level is, if the cholesterol level is greater than 240 milligram per deciliter, then the person is having this hypercholesteremia or hyperlipidemia. Right. Coming to the next question, question 25th. Okay. So, the Dash Samhita includes references to drugs of animals, plants and mineral origin used until the 1st century AD. So, here they have given 4 options, Ebers, Charaka, Hippocrates and Sushruta. So, the correct answer is Charaka. So, it is also a direct question. Right. So, coming to the next question, 26. Who is the father of medicine? Yes, who is the father of medicine? So, here they have given 4 options, Ebers, Hippocrates, Egyptian and Pontus. So, the correct answer is Hippocrates. Then, who is the father of pharmacy? Proctor, William Proctor. So, William Proctor is considered as, or he is the father of our pharmacy. Okay. Then, who is the father of our Indian pharmacy? Mahadeva Lal Shroff. Okay, he is the father of Indian pharmacy. Right. So, father of medicine is Hippocrates. So, coming to the next question, 27th question. Yes. Formulations made up of numerous plant extracts are referred. Okay. So, okay. It is also a direct question from Citrix, that is formulations made up of numerous plant extracts are referred to as. So, here they have given 4 options: galanicals, parenterals, plant vehicles and generics. So, the correct answer is galanicals. So, galanicals are the crude drugs which are obtained from plant and animal origin. So, next question is question 28. The first pharmacy shop was opened in. Okay. So, the options are London, Baghdad, Bangalore and Damascus. So, it was first opened in Baghdad, that is in Iraq, in 754 AD. Okay. In India, it was first opened in 1811 in Kolkata. This is in case of India, right? It is AD. At that period it was opened in Baghdad. So, correct option is Baghdad. Next question. So, the first IP, that is Indian Pharmacopoeia, was published in 1965, 1975, 1955 and 1985. So, this is also direct answer, that is 1955. The first Indian Pharmacopoeia was published in this year. And next question is, the Pharmacy Act came in force in. It is also a direct question. So, here, right. So, what are the given options? 1947, 1948, 1949 and 1950. So, the correct answer is 1948. So, Pharmacy Act came into force in 1948. Right. So, next one is 31st question. Okay. Done. So, this is beta carbolin. Okay, this is not tricarbolin. Beta carbolin ring system is present in. Okay, so in which drugs it is present? Like for example, first option they have given is amitin, next riboflavin, diserpidin and D-tubercularin. Okay, so this beta carbolin structure, it mainly consists of this benzene, pyrrole ring and pyridine ring. Okay, so this is present in case of this diserpidin, okay, which is obtained from 𝗪𝗏𝗪 roots of 𝗪𝗏𝗪. It is having both anti-hypertensive activity as well as antipsychotic activity, which is having anti-hypertensive, means which is used for treating a BP. It is a anti-hypertensive as well as antipsychotic agent. Okay, so the correct answer is diserpidin. So remaining will not be containing this beta carbolin ring system. Coming to the next question, question 32, right. So when the action of the drug is opposed by other drug, so the phenomenon is known as, means the action of one drug is opposed by the action of other drug. So what are the options here? Antagonism, analgesic, addition and antioxidant. So here antagonism means the action of one drug will be opposed by the action of another drug. Okay, they are going to interact with each other. So one drug's therapeutic activity will be interacted with that of another drug. So that is called antagonism. Coming to the next question. So a convenient method for mixing redox substance is. So what is a convenient method? So here they have given 4 options, that is spatulation, tumbling, sifting and trituration. So it's a direct question, that is spatulation. Spatulation is a method for mixing redox substances. Coming to the next question, hepatitis. Right, hepatitis is an example of, what is a type of vaccine? So here they have given 4 options, subunit vaccine, killer vaccine, toxoids vaccine and recombinant vaccine. So, hepatitis B vaccine is obtained by rDNA technology. So, it is a recombinant vaccine. So, it is an inactivated vaccine. This is an inactivated vaccine. Next question, a biguanide derivative. Right, a biguanide derivative which is used as an anti-malarial drug. It is used as an anti-malarial drug. So, here they have given 4 options: guanethidine, proguanil, primaquine and pyrimethamine. So, these 3 are anti-malarial drug and this is used for BP. Okay, right. So, out of these 3, so biguanide is nothing but this is the structure. Okay, so NH2, see instead of urea, that is O, they have added here NH, next here NH, NH2. 2 guanide rings are joined like NH2, C double bond NH and NH2. So, this is the guanide ring. So, 2 guanide rings are combined together by guanide ring. That this proguanil drug consists of this ring structure. So, correct answer is proguanil. Coming to the next question, question 36. Right. So, which of the following alkaloid derived from tyrosine? So, tyrosine is a amino acid, right? So, they have given 4 options: quinine, morphine, atropine and ephedrine. So, ephedrine is derived from tyrosine. Next, list of equipment required for efficient running of pharmacy. Covered under which schedule? Just now we have discussed. And for new, okay, that includes all the requirements and guidelines for opening a new pharmacy. So, what will be the option? Schedule N. Schedule N is the correct answer. So, what is Schedule M? Schedule M is for manufacturing and Schedule P, already I have discussed. So, Schedule P is for either storage, shelf life and Schedule P1. P1 is for packaging. It is for packaging. So, which includes all the guidelines and standards for packaging. Next is Schedule F. It includes all the standards and regulations for blood bank. Okay, and Schedule N is for running a pharmacy. So, coming to the next question. The first US Pharmacopoeia was published in. It is also a direct question. So, here they have given 1820, 1822, 1823, 1821. So, the correct answer is 1820. Okay, right. So, next question is tablet defect explanation. Okay, tablet defect explanation. So, here they have given the various types of tablet defect and what is the definition of that defect. So, here they have given 4 options: picking, sticking, lamination and mottling. Okay, so what is this picking? So, picking is nothing but this. It's a process in which the surface material from tablet that's sticking and removed from the surface, means a small core or a part of this tablet will be removed from the surface. So, that is picking. So, here it is for option 3. Next, sticking. Sticking is nothing but it is adhering to the dye or sticking to the dye. So, the tablet material adhering to the dye is known as sticking. So, Q is for 4. And next one, lamination. So, just you remember laminating. When you are laminating anything, how you will put just like a photo frame, then back of that there will be one sheet. Okay, means it will be like a layers. Okay, so lamination is nothing but the separation of tablet into 2 or more layers. So, just remember like this, lamination is separation into layers. Okay, so next one is mottling. So, mottling is nothing but unequal distribution of color. So, what will be the correct answer? So here for P it is 3, right, for P 3, next Q it is 4 and R 2 and next S for 1. So option C is the correct answer. Next question, that is question 40, latest amendment in DPCO. So what is this DPCO? Drug Prices Control Order. Drug Prices Control Order. So latest one is in 2023, that is May 11, 2023. It has been issued on May 11, 2023. It is also a direct question. And next question is, which of the statement is true for flocculated suspension? Okay, right. So here they have given 4 options. So first one is particle exists as separate entities. Okay, if they are separate entities, while say it as flocculated, flocculated is nothing but agglomeration of the particles will be taking place. Okay, so here particle exists as separate entities. So it is wrong. Right, next sedimentation is slowly formed. No, if particles are aggregating, so all the particles aggregate, then the size of the particles will be increasing, isn't it? So that they get settled very fast. So here sedimented, slowly formed. No, it is sedimentation will be it will be very fast. And what is the third option? Sediment is difficult to redisperse. No, it will be very easy to redisperse. Means the redispersion will be very easy with simple agitation. Okay, so this is also wrong option. And rate of sedimentation is high. Yes. See, when they are agglomerating, what is happening here? The size is increasing so that they get readily sedimented. Okay, so the rate of sedimentation is high. So which one is correct answer? Option 4 is the correct answer. Coming to the next one, which of the following is anthranic acid derivative? Okay, so here ethacrylic acid, methyl dopa, furosemide and heparin. So furosemide is a anthranic acid derivative. Coming to the next question, 43. So which of the drug is triterpenoid root? Okay, so which drug consists of a triterpenoid? Which root consists of a triterpenoid? Here they have given 4 options: valerian, brahmi, shatavari and arusa. So the correct answer is shatavari. Okay, right. So next 43, 44th question. So here an ethylene diamine derivative used as anti-tubercular drug, which is used as an anti-tubercular drug. Okay, so here they have given 4 options, that is ethionamide, pyrazinamide, isoniazid and ethambutol. Out of this, which is having a ethylene diamine derivative? So it is ethambutol. So it is having ethylene diamine with butanol structure, like 2-hydroxy. So 1-hydroxy butyl structure will be there. So the correct option is ethambutol. Next question, that is 45th question. Right. So megaloblastic anemia is caused due to deficiency of what? Okay. So here they have given 4 options. Option A, cobalamin. So nothing but our cyanocobalamin, vitamin B12. So next one is pyridoxine, that is vitamin B6. Next, niacin. Niacin is vitamin B3. And folic acid. Folic acid is vitamin B9. So generally deficiency of cyanocobalamin, that is vitamin B12, causes pernicious anemia. It causes pernicious anemia. So it is a condition in which there will be decrease in RBC count. Okay, decrease in RBC. Next is pyridoxine. So pyridoxine, peripheral neuropathy. It is used for treating peripheral neuropathy. Means deficiency leads to peripheral neuropathy. It leads to peripheral neuropathy. Right. So next one is niacin, that is vitamin B3. So vitamin B3 deficiency leads to pellagra. Okay, nothing but 4 Ds. Okay, diarrhea, dementia, and dermatitis, and finally it also leads to death. That is very, very dangerous. And last one, folic acid. So, folic acid deficiency leads to, that is megaloblastic anemia or macrocytic anemia. So, it is a condition in which the RBC size increases and thereby it leads to decrease in the RBC and hence it leads to anemic condition. So, folic acid causes megaloblastic anemia or it is also known as macrocytic anemia. So, the correct option is folic acid. Coming to the next question, match the following biomolecules with their simplest units and choose the correct sequence option. Yes. So, here what they have given, proteins, carbohydrates, lipids and nucleic acid. So, what are the building blocks of this one? Okay. So, proteins. If you see here, amino acids are the building blocks of these proteins. Okay. So, for right. So, here next one is carbohydrates. So, carbohydrates, monosaccharides, disaccharides, trisaccharides. Okay. Next, lipids, lipids and triglycerides. And next, nucleic acids, it matches to nucleotides. Okay. So, what are the option? Correct option. So, for 1, it will be B. Okay. For 1, it will be B. Next 2, it is C. 3, D. And next, okay, 4, A. So, this is the correct option for this one. Next question, 47. Right. So, how many cranial nerves are present in human body? Okay. So, generally there will be 12 pairs of cranial nerves and 31 pairs of spinal nerves will be present. So, here they have given 4 options, out of which directly 12 pairs is the correct answer. So, next question, right, dash connects to the bones. Okay, dash connects to bone. So, here they have given cartilage, areolar, ligaments and tendons. So, what is cartilage here? So, cartilage is it covers the bones. Okay, it will be very soft and it covers the bones, which gives structure to our nose, ears and our larynx. Right. So, this is cartilage. Next, areolar. Areolar, it is a connective tissue between the skin and muscle. Okay, between the skin and muscle. And next one is ligaments. So, ligaments, it is bone to bone. Whereas tendons, it is muscle to bone. Okay, bone to muscle or muscle to bone. So, what is the correct answer here? Ligaments. Next, 49th question, which gland controls the functioning of other endocrine glands? So, what are the options here? Thyroid gland, pineal gland, adrenal gland and pituitary gland. So, pituitary gland is it is considered as master gland because it controls all other endocrine glands. So, it is considered as a master gland and the correct option will be the pituitary gland. So, coming to the next question, right. So, here the equipment listed. So, here they have given the properties and the equipment. So, how they are going to identify this one? So, here first option is particle size determination. So, this particle size determination is done by cascade impactor. So, particle size determination is done by cascade impactor. And next one is identification of propellants. So, propellants can be identified by using IR spectroscopic method. Next, stability of the foam. So, foam stability can be determined by using rotational viscometer. And next, flash point. This flash point can be determined by tag open cap apparatus. Okay. So, and pycnometer. So, what is the use of pycnometer? It is useful for determination of this density or specific gravity. Okay. So, for A, for 1 it is T. So, this one is the correct answer. Option C is the correct answer for this one. Right. So, next coming to the 51 question. What is the average total lung capacity in healthy adult males? So, this is also a direct question. Here they have given 4 options, about 6 liters, about 4 liters, about 8 liters and about 10 liters. So, the correct option is about 6 liters. So, next one, following is the correct order of aromaticity. Okay. So, here they have given three molecules, that is furon, pyrrole and thiophene. Okay. So, what is the structure of furon here? So, furon structure is this one, this is furon, next this is pyrrole. So, these are heterocyclic compounds and next one is thiophene. Okay, this is furon, this is pyrrole and this is thiophene. Right. Okay. So, first of all, what is the basic criteria for a molecule to be aromaticity? Okay. So, how can you say that the molecule is aromatic? So, the first thing is it should have a cyclic compound. It should be a cyclic compound. First thing, it should be cyclic. Next, it should be planar and it should have a conjugated double bonds. Right. And next, it should undergo sp2 hybridization and next it should follow or it should satisfy Huckel's rule, that is 4n plus 2 pi electrons. Okay. So, here these three furon, pyrrole and thiophene are said to be aromatic because they are cyclic in nature, they are having sp2 hybridization, they are planar and they are having lone pair of electrons, like whatever the lone pair of electrons present on this, that will be contributing for this delocalization of these electrons. So, these three are considered to be aromatic. But only thing is, out of these, which one is more aromatic? See, here what is happening? Oxygen is high electronegative atom. Okay. So, next comes to the nitrogen and next it will be sulfur. Okay. So, if an atom is high electronegative, then what it will do? It will not allow or it will not give its lone pair for delocalization of the electrons. Okay, it will not give readily. It is contributing, but it will not give readily for delocalization of the electrons. Okay, therefore, furon will be having less aromaticity. Okay, so furon will be having less aromaticity. So, next comes to nitrogen, that is pyrrole. Okay, next comes to thiophene. Okay, so the correct option will be thiophene will be more aromatic. Next comes to the pyrrole and next it will be furon. Right. Coming to the next question. Identify the phenol group containing amino acid from the following. Okay. So, leucine, tyrosine, tryptophan and asparagine. So, tyrosine is considered as a phenolic group containing amino acid. Okay. So, what will be the structure here? So, its structure will be CnH2, here COOH, then it will be having one more C. So, amino acid is nothing but it will be having an amino group and acid group, right. So, simply it will be having this methyl group in between and phenolic group. Okay. So, tyrosine is the amino acid which contains this phenolic group. So, correct answer is tyrosine. Right. So, next question, thioglycolic acid is used in. Okay. So, here they have given 4 limit tests, that is limit test for chlorides, limit test for sulfates, limit test for iron and limit test for arsenic. Okay. So, in case of chlorides, generally we will be using silver nitrate as a reagent for reacting with that chloride impurities. And in case of limit test for sulfates, we will be using barium sulfate reagent which contains barium chloride. Okay. So, that will react with that of the impurities. Next, in case of iron, we will be using thioglycolic acid. Okay. Thioglycolic acid, so which reacts with that of that iron impurities and forms ferrous thioglycolate. Okay. So, last one, arsenic. So, in case of arsenic, the arsine gas will react with our mercury chloride paper, and therefore it gives yellow to brown stain. So, here what they have asked, thioglycolic acid is used in. So, it is used in limit test for iron. Okay, right. Coming to the next question. Question 55. Regarding the assertion and reason, choose the correct option. Okay, so what is assertion here? The peripheral nervous system constitutes all the nerves and ganglia that lie outside the central nervous system and connects the extremities of the body to the central nervous system. Yes, that's true, because central nervous system will be collecting the information from peripheral nervous system via this afferent sensory nerves. Okay, and the CNS is responsible for all the information processing and control. Yes, this is also true, and this assertion, the reason is the correct, it is the correct reason for that assertion also. So, what is the option here? Correct option. So, assertion A is true, reason is false. No, it's wrong. And next, reason R is true and assertion is false. Wrong. Assertion A is true and reason R is true, and A is the correct explanation of A. So, option C is the correct answer. Right. So, next 56th question. Okay, just now we have discussed the same question. Patients with which of the following diseases are treated with injections of vitamin B12? Okay, so here they have given 4 options, that is Bell's palsy, Crohn's disease and Graves disease and pernicious anemia. Okay, so pernicious anemia is a condition where there will be a deficiency of vitamin B12. So, vitamin B12 injections are given in order to treat this pernicious anemia. So, the correct answer is pernicious anemia. Next question, which of the following organs, yes, it will remove bilirubin from the blood. Okay, manufactures plasma proteins and is involved with the production of prothrombin and fibrinogen. So, here they have given gallbladder. No, it's wrong. Next, kidneys, that is an excretory system. Next, spleen, that is also wrong. Liver is the correct answer. Just now I have told you bilirubin is formed by this RBC, breakdown of this RBC. Okay, so this bilirubin will be excreted, or it will be eliminated, or it will be removed from our body by our liver. Okay, so answer will be the liver, and where there will be a production of this prothrombin and fibrinogen also will be taking place. Right. So, next one, 58th question. So, which of the following conditions is characterized by incompetence of esophageal sphincter? Okay. So, already they have given here the structure. So, what are the options here? Crohn's disease, esophageal varices, gastroesophageal reflux disease and pyloric stenosis. Okay. So, this is a structure of stomach, right? So, here there will be a sphincter, okay, that is esophageal sphincter. So, this, if it is not closing properly, if the sphincter is not closing properly, then what happens? There will be a reflex of this stomach contents, whatever the stomach contents are there, they will be reflexing back into the esophagus. Okay, so that condition is known as gastroesophageal reflux disease, that is GERD disease. Gastroesophageal reflux disease or disorder. So, correct answer is this one, gastroesophageal reflux disease. If the sphincter is not closing properly, then will be a reflex of all the stomach contents into the esophagus. Right. So, coming to the next option, next question, 59th one. Yeah, just now we have discussed this one also. Foam stability is measured by, okay, it is measured by IR, UV, rotational viscometers, all. So, obviously it is rotational viscometers. So, next question, given below are equipment used in the manufacturing of following products P2S and match them with the correct answer. Okay, here they have given equipment and the products, and which is the correct answer for this one. So, we need to match that one. So, what are the given equipment? Genesee, HEPA filter, kilsonator and axilla coata, right. So, immediately when you see this axilla coata, go for coating. So, tablet coating, okay. 𝐓𝐞𝐬𝐭. So, next J-Lacy is for emulsions, and next HEPA filter for injectables, and next 𝐓𝐿 is for tablet granules. Okay, so what is the correct answer? For 1 it is R. Here they have given the options are wrong, just correct this one. So, for 1 it is R, for 2 HEPA filter it is yes injectables, for 3 𝐓𝐿 it is tablet granules, right. Next 4 axilla coata for coating. So, this is the correct answer. Just make it corrected. P 2 times it was there, just replace that P with that of this R. Coming to the next question, question 61. Okay, calculate the amount of sodium chloride to make 1.5% solution of pilocarpine hydrochloride isotonic to tear fluid. Okay, so generally this can be done by freezing method. So, they have given freezing points. Okay, so it is a method of adjusting the isotonicity. Okay, whenever the preparations means which are meant for giving injectables or any lacrimal means ophthalmic preparations, they are going to instill into our body, right. So, they should, whatever the solution they are preparing, that should be isotonic to our body fluids. So, in order to prepare that one, there are different methods for adjusting the isotonicity of that particular drug preparations. So, this can be done by using cryoscopic method. So, in case of cryoscopic method, the formula is, so W% that is equal to 0.52 minus A by B. Okay, so this is the formula for calculating this one. So, what is A here? So, A is nothing but the freezing point, freezing point of 1% solution of this drug, okay, pilocarpine drug, and next B is the freezing point of 1% solution of sodium chloride. So, here we are going to adjust with this one. So, here first you need to calculate A. Okay. So, what is A? A is nothing but it is the freezing point of 1% pilocarpine hydrochloride. So, here they have given 1% pilocarpine hydrochloride's freezing point is, so 1% it is 0.130. Okay. Then we need to calculate it for 1.5% solution. So, for 1.5%, so what will be the answer? Okay. So, how we are going to calculate? So, 1.5 by 1 into 0.130. So, it will be around 0.195. Okay. So, after getting this one, so what you have to do? You have to put those values into this one. So, that is 0.52 minus, so what is the A value here? 0.195. So, 0.195 divided by, so next B, what is the freezing point of 1% solution of the sodium chloride? 0.5760. So, 0.5760. So, that you will be getting this one, 0.564. Okay, so this is the correct answer. So, this is done. So, here they have given freezing point. Okay, so by using that freezing point, directly we are having a formula for calculating this isotone, adjusting the isotonicity of the solution. So, that is 0.52 minus A by B. So, A is for adjusting drug. So, whatever the drug we want to adjust for that, and B is the freezing point depression of this sodium chloride. So, first we need to calculate it for 1.5%, then you put that into here so that you will be getting the final answer. Right. Coming to the next question, 62, identify the antioxidant among the following. Okay. So, here they have given options. So, what are those? Ascorbic acid. Yes, we know that ascorbic acid contain, it is having an antioxidant property. And next one, triethanol amine oleate. So, generally this triethanol amine oleate is used for cleaning the ear wax. Okay, so during when we visit this ENT doctor, they will be removing that wax in order to have a perfect vision. Okay, so for that sake they will be using this triethanolamine oleate. So it does not have any antioxidant property. And next one, gallic acid. Yes, it is also having antioxidant property, and thiourea also has antioxidant property. So PRS, these are considered as the correct answers. So PRS, option B is the correct one. Coming to the next question, 63. Right. So here half-life. Right. So assertion. So what is assertion here? Half-life of a reaction can be used to predict order of the reaction. Yes, half-life of the reaction can be used for determining or predicting the order of the reaction, like zero order, whether it belongs to zero order, first order, second order. So this one is the correct assertion. And what is the reason? The relationship between half-life and the initial concentration of the reactant is dependent on the order. Yes, because as it is dependent, then only we can easily determine the order of the reaction based upon the half-life of the reaction. Yes, both are correct. So here assertion and reason correct, and this is the correct reason for that assertion, right? So what are the options here? If both assertion and reason are correct statement, and the reason is the correct explanation of the assertion. Yes, the first option is the correct one. Coming to the next question, 64. Right, steel ampoules containing a thermostable drug solution are commonly sterilized by, here they have given 4 options: hot air oven, autoclave, next microwave oven, and UV chamber. So the correct answer is autoclave. By using autoclave, we will be sterilizing this ampoules, steel ampoules. Coming to the next question, 65. Which of the following sequences correctly describes the change in domain structure as more oil is added to the water in oil suspension, emulsion. So already it is a water in oil emulsion. To that water in oil emulsion, what we are adding? We are adding more oil. So what will be the domain of that structure? Okay, so here the domain of this, when we are adding oil, the spherical structure will be dominating. Okay, so more the droplets your oil is adding, more the spherical structures will be formed. So spherical will be dominating first. So next, then the cylindrical like, and then it will be a bicontinuous. So the option B is the correct answer for this one. Coming to the next question, 66. So the storage condition for insulin injection. So what is the storage condition for insulin injection? The first one is 2 to 8 degrees for 24 months, minus 2 degrees for 24 months, 25 degrees for 24 months, minus 8 for 24 months. So the correct option is 2 to 8 degrees for 24 months. So next question, which of these is used as carminative and antispasmodic? So it is also having antispasmodic activity. So jalap, gamboge, asafoetida and witch hazel. Right. So obviously asafoetida is the correct one, which is used as a carminative while we are preparing our sambar and everything. Also we will be using this asafoetida, nothing but hing. Okay, and it is also having antispasmodic spasm. It relieves us from spasms. So that's very good one. Right. So asafoetida is the correct answer. Coming to the next question, match the following injuries with the appropriate first aid. Okay, here they have given what is the first aid, and here they have given injuries. If there is a broken arm, then what you are going to do? You will be wearing the arm sling bandage, or you will be wearing this arm sling bandage. So the first option will be arm sling. And next, deep cut. Whenever there is a deep cut, you will be applying a lot of pressure in order to stop that bleeding. So deep cut, then apply pressure. Right. Next, burns. So what you will do? You will be running water. You are keeping that part in the running waters, immerse in water. So for burns it is C. So for 1 it is B. Next for 2 it is A, and 3 it is C. So option B is the correct answer. Coming to the next question, 69. So, which of the following statements is true about the passive immunity? Okay, so here they have given 4 options. So, first one, this immunity causes reactions. Yes, definitely we'll be having some reactions, either swelling or fever. Okay, so this causes some reaction, and this immunity develops immediately. Yes, this will be developing immediately, whereas active immunity, it develops, it requires some time for development, and this immunity lasts only for few weeks or months, okay, but not lifetime, whereas active immunity, it lasts for lifetime. So, all of the above, yes, these all are related to the passive immunity. So, all of the above is the correct answer. Coming to the next question, iodine 125 is used as, so it is a radioisotope. Iodine 125 is a radioisotopic drug. So, it is used in both diagnosis as well as therapy. Okay. So, especially iodine, by seeing the iodine itself, you can tell that it belongs to thyroid function only. Okay. Right. So, first one is thyroid functioning. Yes, it is used for treating the thyroid functioning. And next one, to detect and estimate the thyroid hormones, for detecting the thyroid hormones in the body fluid. Yes, both A and B are correct. So, both A and B are correct. Option C is the correct one. So, option C is the correct one. So, next, coming to the 71st question, which of the following statements are statements about alcohol is incorrect? So, they have given here incorrect. So, just you have to check the question also whether they have given correct or incorrect. Right. So, what is the first option? Tertiary alcohols have lower boiling point than the primary alcohols with an equivalent molecular weight. Okay. So, as we move from primary, secondary and tertiary alcohols. Okay. So, what happens when we move from primary to secondary, secondary to tertiary? The branching increases. Okay. So, whenever the branching increases, so here the size gets reduced, surface area will be reducing. So, whenever the surface area reduces, it requires lesser boiling point. Okay. So, therefore, primary requires this one. Primary alcohols requires more boiling point than secondary than tertiary. So, here what they have given, tertiary alcohols are having lower boiling point. So, that is a correct one. Right. Next, alcohols undergo nucleophilic substitution reaction. That is also true. Next, tertiary alcohols undergo dehydration more readily than the primary alcohols. Yes, that is also true. And last one, tertiary alcohols are metabolized in the body to ketones. No, they are not going to metabolize in the body to ketones, but they are going to metabolize to acetaldehyde. Okay, first these alcohols. So, if any person take alcohol, it gets first metabolizes to acetaldehyde. Later on, it will be converted to acetate. Okay, then it will be further metabolized to water and carbon dioxide, and that will be eliminated out of the body. And but this is the very dangerous one. So, that is why, because of if it is not metabolized further, it leads to some liver cirrhosis or liver damage. So, this is not the correct one, not ketones, but here it is a aldehyde, acetaldehyde. So, what is the correct, incorrect option here? So, incorrect option is option D. Right. So, coming to the next question, 72, assertion. So, what is the assertion here? 𝐓𝐴 is used as a medicine. Yes, that's true, because 𝐓𝐴 is having a laxative property. 𝐓𝐴 is having a laxative property, which is used for treating the constipation, means which evacuates the bowel. Okay, so what is the reason they have given here? The husk of 𝐓𝐴 contains mucilage. Yes, that is also true. Since it contains mucilage, it acts as a laxative, means which helps in evacuating the bowel. So, both are correct, and it is the correct reason for the assertion. So, what is the correct option? If both assertion and reason are true, and the reason is the correct explanation of assertion. Yes, this is true. So, option A is the correct answer. Next, coming to the 73 question. Extracellular fluid includes. Okay. So, here what they have given, extracellular fluids includes, right, here they have given, right, see, what is intracellular fluid? The fluid which is present within the cells. The fluid which is present within the cells is known as intracellular fluid. Okay. And the fluid, whatever it is present between the cells. Okay. The fluid which is present between the cells is known as interstitial fluid. Means within these cells, in between these two cells is known as interstitial fluid. It is interstitial fluid. Okay. And what is vascular fluid? So, vascular fluid is nothing but the fluid which is present within the blood vascular system like RBC, WBC, okay, and whatever the fluid that is present in the blood vessels is known as vascular fluid. Right. So, here these two, interstitial fluid and vascular fluid, are considered as extracellular fluid. These two are considered as extracellular fluid, whereas this, whatever the fluid that is present within the cells, is considered as intracellular fluid. Okay. So, what will be the correct option? Interstitial and vascular fluid is considered as a extracellular fluid. So, option B is the correct answer. Coming to the next question, Burnet syndrome. Okay. So, Burnet syndrome, here Burnet syndrome is associated with the prolonged use of. Okay. So, this Burnet syndrome is also known as milk alkali syndrome. It is also known as milk alkali syndrome. So, what does milk contains? Calcium. What is alkali? Alkalis are nothing but this calcium, magnesium, aluminum. Okay. So, upon prolonged use of all these one, that is antacids like calcium containing antacids, magnesium containing antacids, aluminum containing antacids. So, if we are going to use prolongedly, then it leads to this Burnet syndrome or milk alkali syndrome. So, the correct option is D. Coming to the next question, question 75. Right. The pro-gastrokinetic action of the following drugs is attenuated by atropine. So, what is this pro-gastrokinetic action? So, pro-gastrokinetic is nothing but it is going to increase the motility, gastrointestinal motility. So, that is helpful in treating the patient suffering from constipation. So, in case of constipation, what happens? So, the motility, gastrointestinal motility will be very reduced. Okay. If the motility reduced, then evacuation of the bowel will not be taking place and reabsorption of the water occurs, and finally it leads to constipation, and that constipation can be overcome by using this laxatives or various drugs can be used. So, here the pro-gastrokinetic action of the following drug is attenuated by atropine. So, here these are the two drugs like metoclopramide and cisapride. These are the two drugs whose action will be reduced by taking the atropine. Means if you take these two drugs along with that atropine, atropine is going to reduce the action of this one. So, which is the both A and B is the correct answers. So, option D is the correct answer for this one. Right, coming to the next one, which of the following is an example for supra-additive synergism? Okay, supra-additive. So, generally additive means will be taking two drugs simultaneously, means which adds the which increases the therapeutic activity. Supra-additive means which increases therapeutic activity over a long period of time, means more than that what a single drug is having. Okay, so here nitrous oxide and halothane and levodopa, carbidopa, amlodipine, atenolol and glibenclamide and metformin. So, these are the combinations. So, this nitrous oxide, halothane, amlodipine, atenolol, and these are used, they are having synergistic activity only, they are having additive action, but levodopa and carbidopa are having supra-additive activity. So, levodopa and carbidopa is the example for this one. And one more example is that sulfa-methoxazoline and trimethoprim also having this supra-additive property. So, next one is 77. Right. So, here assertion, carbohydrates are more suitable for production of energy in the body than proteins and fats. Yes, carbohydrates are upon degradation, upon metabolism of these carbohydrates, that glucose will be obtained. Right. Next reason, carbohydrates can be stored in the tissues as glycogen, can be used for production of energy whenever necessary. Yes, this is also true. Carbohydrates can be stored in the tissues as glycogen, can be used for production of energy whenever necessary. Yes, both assertion and reason are the true, but R is not the exact reason for this assertion. So, here both assertion and reason are true, but the reason is not the correct explanation of this assertion. So, option A is the correct answer for this one. Next, coming to the 78th question. Characteristic features of intramuscular route of drug administration. So, here they have given 3 options. Hypertonic solution can be injected, only water solutions can be injected, only oily solutions can be injected. Yes, here first one is hypertonic solutions. Generally, we are not going to use hypertonic solutions. Always we will be using isotonic solutions, which is having the same concentration with of our body fluids. So, the first option is wrong. See, water solutions. So, that can be given either subcutaneously or it can be given IV also. Okay, this is also wrong. And oily solutions can be injected. So, this is a correct answer. For getting a prolonged action, we will be using this one, this route. So, answer only 3 is the correct answer. This is this one. Next, coming to the next question. Pyridine. So, pyridine is more basic than pyrrole. This is due to which of the following facts? Okay, right. So, what is the pyridine structure? So, this is the pyridine structure. Okay, it is the pyridine structure, and if you see the pyrrole structure, so this is the pyrrole structure. Okay. So, here, so what is basic nature? What is meant by basic nature? Which accepts a proton is said to be basic, right? So, here it is having a lone pair of electrons on it. Okay. So, it can readily accept the proton because of that lone pair of electrons, but these lone pair of electrons are involved in delocalization. Okay. In order to have the aromaticity, it will be involved in formation of a pi molecular orbital. Whereas, here in case of pyridine, see, already it is having all the 3 bonds, 3 double bonds are there. It is satisfied. Okay, right. So, the lone pair of electrons, with this, it can readily donate to the proton to accept that proton, and it can form the bond. Okay, right. So, so what they have given here, lone pair of electrons and on nitrogen in pyrrole is localized. No, it is not localized. It is always under delocalization to form the pi molecular orbital. So, the first option is wrong. Okay. So, what is the second option? Lone pair of electrons and nitrogen pyridine is localized. Yes, it will be here only. They are not involved in any formation of pi molecular orbital. So, that they can readily accept a proton to form a bond. So, this is the correct answer. So, nitrogen of pyrrole has 1 hydrogen atom attached to it, while the pyridine does not have any. No, this is also wrong option, and pyridine has 3 double bonds while pyrrole has only 2. That is also not exact answer here. So, the exact answer is lone pair of electrons and nitrogen in pyridine is localized. Coming to the last question. Which of the following is involved in biosynthesis of acetylcholine? Okay. So, during the biosynthesis of acetylcholine, here serine, the alpha amino acid is involved. Okay. From the serine only the acetylcholine will be synthesized. So, the correct option is D. Okay, I hope you understand all the questions here, and I hope you got all the answers. If you have any queries, just you can post it in the, just you can post that questions. Okay, I will be giving you answers, and all the best. So, any queries also you can post it.